Hello, I'm Michael Hainsworth. 1 in 3 Ontarians do not have access to workplace health and dental benefits. In its commentary titled Better for Workers, Better for All, Assessing a Portable Health Benefits Plan in Ontario, the Howe Institute investigates a possible solution for that almost 30% of those in the province who need coverage. A portable health benefits plan would allow a worker to maintain coverage while moving from job to job. Meet Chris Bonnett. He is a principal at H3 Consulting, providing advice on public and private prescription drug policy and programs in workplace health benefits. Bonnett penned the study for the Institute and finds a PHB plan to be feasible, affordable, and sustainable. Representing the CD Howe is Senior Policy Analyst Rosalie Wyonch. They join us now. Thank you for joining us.
Thank you.
Happy to be here.
Rosalie, who are these Ontarians who make up a third of the workforce without benefits?
Well, these Ontarians are among all walks of life, all ages. However, they tend to be the people that are employed, potentially part-time or are maybe less attached to a formal employment, so they don't have access to benefits through their jobs. As well, there's been a growing segment of employment in what we'd call the gig economy or contract workers. And really, those workers are, as independent contractors, are not obviously not going to be covered by an employer. And though they might be able to purchase insurance for themselves, when you're as an individual, that can be prohibitively expensive. And so it's a combination of contract workers, gig workers, part-time workers, as well as, a few others who might fall through the cracks of the existing government social support programs.
So then let's talk about the prohibitively expensive component. Chris, if a worker goes from a job with a great benefits package to one without a plan, who would be paying for it?
I guess typically if an employee moves from a plan where there are benefits or an employment where there are benefits to one that isn't, or that has none, my language is obviously slipping. It's maybe too early in the morning. More coffee is necessary. Then
there's no plan for that, I'll tell you that.
I thought it was part of the service. There is basically it moves to out-of-pocket costs. And for many people, that can be affordable, right? If an average drug costs about $80, most people might be able to find that. But there are lots of drugs that are now thousands of dollars, tens of thousands, even hundreds of thousands of dollars, and nobody can afford access to those without insurance. But it goes beyond drugs. You might also need dental work. You might also need glasses or contact lenses in order to work. If you can't see well, if you can't hear well, if your teeth are a visual problem, then that frustrates employment, frustrates people getting good, high-paying, and secure jobs. So those are problems if all of this becomes out of pocket, and that's, as Rosalie said, important for probably almost a third of the Ontario population.
So then if there is a portable health plan, who would be paying for that?
Well, there is no model for portable health benefits in Canada yet. So this study was interesting because it was the first time that we really looked into it in a Canadian context. It was born from the Ontario government's interest in portable health benefits. They struck a panel that's supposed to report at the end of the summer. There's just a real opportunity here, I think, to do something different, novel, innovative, and get people access to essential health services that are not covered through Medicare.
I can imagine, though, Rosalie, that small employers that don't currently provide a health benefit plan would have a problem with having to pony up in a PHB.
Well, and that's something that we do need to be careful of, particularly given the high inflation environment and the pressure in terms of, labor shortages and all the other factors that affect small businesses. We do have to ensure that the costs for them would be manageable. However, it can also be a benefit to employers to offer private insurance. It's part of why larger employers already tend to do so. It can, help with employee retention. And having healthy workers generally means that you have more productive workers. And so, though there might be some costs for small businesses, there's opportunities for the government to, adapt policies, design policies to ensure that costs are fair, that we're not crowding out that very beneficial investment in insurance from existing employers, but also expanding that coverage with some input from employers to cover the people that are currently uncovered. And in my view, this actually, in some ways, could level the playing field between large and small employers in the province, because if everybody has access to health coverage, then it becomes less of a difficult decision for an individual deciding between two opportunities for employment, one with a small employer and one with a large employer. Benefits could be a large part of that deciding factor, and expanding benefits coverage for the uncovered population really does level that playing field.
It's a great set of points there, and I guess to more fully answer your prior question, the idea of affordable health benefits is that it's going to be shared between the government, the employer, and workers. So that three-way split of costs is actually more attractive than asking employers to come up with 100% of the cost, or even to cost share at 50-50 with workers. So that makes it potentially more affordable to employers. But Rosalie's absolutely right. I mean, this is a tough environment. We're coming out of a pandemic. Not all businesses have recovered from that yet. In fact, many have not. But the idea that you could actually offer benefits, which is a very tax-effective form of compensation, and share the cost three ways, not two ways, or not single-handedly cover them as an employer, is a very positive thing. And on that point, the other thing is that best information we have is that about half of small employers already provide health benefit plans. So that sort of emphasizes Rosalie's point about leveling the playing field. Why wouldn't all employers offer benefits to attract workers, to keep them healthy and productive on the job? That's has social benefit as well as benefit for the employer and the worker, him or herself.
Well, then help me understand how it would work, because to your point about benefits being one of the reasons why one might join one organization versus another, if I'm working with, large corporation incorporated, and they've got a fantastic benefits plan, and then I leave to a smaller employer, maybe it's a startup that's got great opportunity, but they don't really have a great plan, how would that portable benefits plan work such that I still have those benefits? How is it possible that I'm getting great benefits at the little guy shop?
Well, I'll take a stab at that first, and Rosalie can jump in. The goal, I guess, is that we could build off existing administration systems already in place by group insurers across the country. They have all of the information they need about your address, about your employer, about really all the things they need to adjudicate a claim. In other words, are you eligible for these benefits or not? If there's a portable plan and administration is delegated to insurers, for instance, but there are other organizations that could do it as well, then it would just simply be up to the insurer to track you by where you live as opposed to where you work. Just as easy. In many cases, they might be mailing administrative materials or even checks, printed paper checks to your home anyway. They've got to have that information. Their confidentiality record is very, very strong. This is a relatively easy kind of administration for them to pick up. So it should be pretty much seamless whether you're administered through your employer or whether you're administered through your home address. Pretty much the same thing. You would get access, hopefully, to a high quality benefit plan, but that's all up in the air. We're not sure just what scope of benefits the provincial government in Ontario has in mind at this point.
Yeah, and I would maybe add there that we're working with a certain lack of clarity, where this really was born out of a labor discussion. And it's, in our view, and part of why we conduct the research, is that it is actually linked to a much broader discussion about universal coverage for pharmacare, dental, and vision coverage, which is something that, though Canada has a universal system for hospital and doctors, we currently don't have universal coverage for those other health services. And this is, currently being discussed at the Ontario government. And in our view, this could be one of the possible ways to expand coverage to the entire population without shouldering all of that cost on governments or going with a fully public, shall we say, traditional universal healthcare plan. And so this is really an alternative model that's being considered, and there's currently not a ton of clarity around what the overall goal might be. And so this is really, I think, a first in Canada. It's potentially effective and could be a reasonable way to increase coverage for all of those additional services at, a sustainable cost to government. However, because it's the first in Canada, we wouldn't advocate for, a full, let's roll this out tomorrow to the whole population. It will certainly need to involve businesses, healthcare providers, as well as the beneficiaries that are going to be the main targets for the program. It will need to include all of the details and the nitty-gritty reality of making sure that the program functions as intended as it's scaled up. And so there will need to be some testing and refinement as it's rolled out. And we would certainly advocate for at least a pilot, because this is a really exciting idea. It's a provincial and federal priority to improve coverage, particularly for dental and pharmacare, but vision coverage is obviously important as well.
Chris, you mentioned that this would be spread between the employee, the employer, and the province. What, though, about the self-employed, where there is no employer in the middle? There's just the employee and Ontario. Would it be split 50-50? Like, do we have a sense as to what would be the best practices for that sort of thing?
There's limited sort of real-world experience on that at the moment. One model in the United States, for instance, basically said that if you're self-employed, they had a three-way split of premium government employer worker. If you're self-employed, they said, well, if you as the employee wanted to pick up the employer share, in other words, you pay 2/3, the government pays 1/3, then that's how you could get coverage. I don't advocate for that because I think that's just too much on the individual. A lot of the workers we're talking about have quite low earnings. They couldn't afford that kind of 2/3, 1/3 share. So I do think it's an area where governments will have to do some serious planning. We have the counts on self-employed. There are significant numbers in Ontario. And I think, at worst, you'd want a 50-50 share, but then you'd also probably have to have some subsidies again for lower income workers so that they're not priced out of the market and they could still get access to the kind of insurance they need. And let me just also put a little more data on the table here. The latest information we have is that more than 1/5 of Ontarians don't have drug insurance. Between 35 and 40% don't have dental insurance or did not in 2018. We'll see how the federal plan pans out. But almost 40% had no vision care coverage. Vision care can cost you easily hundreds of dollars for glasses. Dental can be hundreds and even well over that if you need significant major restorative work or orthodontics, for instance. And we've already talked about the potential cost of drugs, $1,000 or more. So there is significant need, a lot of people without insurance. This is a way to sort of fill those gaps and put the control in each province. To Rosalie's earlier points, to build on it, man, this is better because a lot of the tension and why we don't have progress in health policy or health programs, developing programs, new programs in this country is because of these federal, provincial, territorial tensions. If Ontario could do something progressive like this, build a plan built on sort of typical group insurance, social insurance kinds of principles, then they can be in charge of the design of it. They can work to have a more effective governance model that includes the employers that are going to be partial funders, the workers that partially fund it, the health professionals that provide the services. There's lots of really interesting things they could do, but it is in the government of Ontario's hands. They don't need to consult with anybody else other than the communities already at work in this particular province. If BC wanted to do the same thing, it was part of the NDP's policy prior to their 2020 election, then they could tailor it to suit their needs, their population. For instance, a more heavily unionized workforce in British Columbia. You could do the same in Atlantic Canada, where the needs are even greater because public insurance tends to be less. So good idea if we could tailor it to provinces. But I think I also want to emphasize we don't want to lose some kind of national standard for what these plans ought to be. They ought to be good enough and not just bare bones stuff that are not really serving the needs of the people that need access to services.
Well, to that point then, and knowing that healthcare is a provincial prerogative, is there a role for the federal government to play in the idea of a portable health benefit plan?
Well, they're playing one indirectly already with their idea of a new almost universal dental plan. That's already been launched, and it will unfold in phases between now and I think 2025, just prior to the next federal election. So there's a lot of new money, billions of new dollars in to subsidize dental care for people that don't have access to it at work. So that automatically reduces the province of Ontario's cost and provides, although we don't know what the final federal dental plan design is going to be yet, they've promised comprehensive coverage. That will help. They put $500 million annually into funding rare disease drugs, which tend to be extremely expensive. Now, employers won't get any of that, but the provinces will on a prorated basis according to population. So that also reduces the provincial cost for these kinds of programs. That does make it more, I think, politically feasible, financially feasible, fiscally feasible for the province of Ontario, and in fact, each province.
Yeah, and I would maybe add that there's really sort of two roles that the federal government already plays, and that is, in attempting to harmonize standards or ensure, a minimum baseline across the country. Currently, the most obvious example would be the principles in the Canada Health Act and the Canada Health Transfer that funds provinces so that they can deliver reasonably equitable healthcare services across the country. And they have an infusion of funding. They are major funders of our healthcare system. However, because healthcare is the jurisdiction of provinces, I personally think that those roles for the federal government are good, but there is potential risk in, shall we say, elevating certain policies and splitting responsibility between the two levels of government. We already deal with quite a few challenges because of that intergovernmental tension. And if we start funding and administering things at different levels of government, then we can also potentially create perverse incentives around, not looking at total healthcare expenditure and total healthcare efficiently, but instead looking at really the individual silos and what lands on which level of government's budget and deciding policy accordingly. We want to make sure that we don't create perverse incentives within that sort of intergovernmental relationship. However, the federal government does have a role to play in ensuring that if it is going to, have funding available or implement a policy to offset the costs of expansions to insurance coverage in provinces, that insurance coverage does in fact meet the needs of the population. To echo Chris, we don't want it to be, we want whatever the expansion in insurance to be, we need it to be adequate and actually meet the needs of the population, or we will have done quite a lot of work for not as much gain as we could. So it is important that we ensure that it actually is comprehensive. However, the issues in intergovernmental relations and who funds what and who's responsible for what, I think are complicated and are definitely going to be worked out along the way.
Yeah, but so the problem with that, though, is that that sort of complexity creates inertia. Right? Everybody sort of sits back, waits for somebody else to take the lead, and nothing's happened. So I think that's one of the advantages of a portable health plan that is managed by provinces. Maybe someday there'll be some additional federal funding to support it. That would be good. As I said, there's already indirect funding through new dental expenditures and rare disease drug costs. Also mental health services that the federal government has invested heavily in that are being distributed to the provinces. But if we wait for this magical convergence of thinking between federal, provincial, territorial governments, Well, we've waited for pharmacare since the Second World War, and that's not happened yet. So I think we need to step into this. And guess what? If we have the right data systems, if we have the right governance structures, the right participants in planning, there's no reason why, well, we probably won't get it perfect on day one. But with those kinds of structural ingredients, we will be able to tune it up. We will be able to refine it. We will be able to ensure that it is meeting unmet needs of people in Ontario, perhaps as much as a third of them, to get these kinds of services. So it won't be perfect day one, but I'm all of a mind now that we better try things, manage them, measure them, then refine them rather than sit back and wait for perfection.
And I 100% agree with that. I would also add that provinces can move unilaterally and expand coverage, and many have already done so. The public programs that cover the unemployed or seniors are provincial programs. And so there are many options for different provinces to consider. A portable health benefits plan, we believe, has a number of benefits and is currently being considered in Ontario. However, there are other models and examples of provinces that have moved and continue to expand the coverage offered by their healthcare system. Quebec, in particular, has had universal pharmacare coverage since the 90s, and it has universal coverage across the entire population. In other provinces, the entire population might be eligible for coverage, but not everyone is enrolled. And so this is really part of the discussion that's been ongoing for, well, quite seriously, decades at this point. As Chris mentioned, maybe as far back as World War II, but that I find that a little bit depressing. So I'll just go with this century. We've made a lot of progress, and there's still a lot of progress to be made. And provinces are currently trying out different models, expanding in different services, and really refining coverage of the gaps where previously we may not have been paying attention. And so it's, as we expand health coverage, we can better and better fill those gaps and ensure that there's equity and efficiency in healthcare delivery across the population, and that, we don't have people that are contract workers or part-time employees falling through those cracks.
So to end our time together, Chris, I want to come back to a point you made at the very beginning when it comes to the optimism that this is something that can be done. You've said that a portable health benefit plan would likely be administratively feasible because private health insurers, pharmacy benefits managers, and third-party administrators are already using similar systems.
Exactly. And I think that's a tremendous advantage because it not only makes sure that people have proven administrative systems. You don't have to build something new, and we don't have to wait for governments to build something new. It's there, and it handles millions of Canadians' health plan claims and cost administration, all kinds of things already. It's on the ground. The good news is that, again, it's not only that it's not something that provinces have to build, but it is something that they can govern. They can control access. Anytime you mention something private and healthcare in the same sentence, you get a lot of pushback. So private insurance has existed since the 1970s. We have, a significant part of our total health expenditures that is privately funded as well as privately delivered. This isn't really going to hit that proverbial third rail of healthcare. But what it does is that, again, if governments decide that they wanted to lightly regulate insurers to ensure that the public interest is met, well, there's precedent for that, which Rosalie will know very well in Quebec. There is a governance structure where the industry reports to the Minister of Finance, I believe, Finance or Health, it escapes me at the moment, but to the provincial government with an annual report every year. It's not particularly onerous on insurers, but it does show that the system is working as designed, and there is political accountability for it. So we can have private insurers doing what they've done for decades with highly sophisticated systems, really good customer service. They can deal with you on the web, by chat, on the phone. Provincial Medicare plans don't have any of those kinds of patient-facing services. Insurers do, and they're time-tested, and they're novel, and they are continually being refined and further developed. This is positive stuff. And it should sort of lower the public-private debate here because these are well-proven systems. People get coverage like this already, and with appropriate regulation, it's not going to slow insurers down, but it will absolutely assure that there is public accountability for a portable health program.
Chris Bonnett is a principal at H3 Consulting. Rosalie Wyonch is a senior policy analyst at the C.D. Howe Institute. Thank you for your time and insight.
Pleasure
Thanks
to be
for
here.
having us.
Thank you.
Read the study titled Better for Workers, Better for All, Assessing a Portable Health Benefits Plan in Ontario at cdhowe.org. Still to come from the C.D. Howe, May 23rd, it's the Patron Circle event, ensuring the future stability of Canada's financial system, with Lee Anderson, President and CEO of the CDIC, Nicholas Lepan, a senior fellow at the Institute and formerly of the Office of the Superintendent of Financial Institutions Canada, and also formerly of OSFI, Jeremy Rudin. I'm Michael Hainsworth. Thank you for joining us.
You've been listening to the C.D. Howe Institute podcast with Michael Hainsworth. Subscribe on iTunes, Google Play, and Spotify. The C.D. Howe Institute is an independent, not-for-profit research institute whose mission is to raise living standards by fostering economically sound public policies. The Institute is widely considered to be Canada's most influential think tank and a trusted source of essential policy intelligence, distinguished by nonpartisan, evidence-based research and subject to definitive expert review. Visit cdhowe.org and follow us on Twitter and LinkedIn. Thank you.